Hey, it's Dr. Cody Raw with Stanford Brainstorm. Today we have a Stanford Brainstorm Virtual and Augmented Reality pitch and interview with Dr. Brandon Birckhead. He's a Radiology Oncology Resident at Medical College of Wisconsin. Dr. Birckhead wants to develop a virtual reality experience to reduce anxiety for those undergoing head-restrictive medical treatment such as dentistry or imaging.
Brandon, thanks for being here.
Yeah, my pleasure.
So how did you hear about the event here at Stanford?
Yeah, so I've been working with Dr. Kim Bullock with VRARA Digital Health Committee, and so she was promoting the whole conference, and then when I went to look at potentially coming, I saw that there was a Brainstorm Innovation Lab, and there was some work that I've done that last year that I thought kind of worked for it, because originally it was an idea that become like its own company, but we ended up kind of more into a research project.
That's awesome, and you're at University of the Medical College of Wisconsin, right?
That's right, yeah.
And you're a PGY too, but not in psychiatry, you're actually a different specialty.
I'm in radiation oncology.
Okay.
So it's its own little small field.
So I imagine that, like, going through that training, you saw certain things in radiation oncology that helped you come up with your idea, right?
It did, in the sense that I'm driven, a lot of my interest in healthcare is technology. I'm a technology enthusiast, and so seeing what I've enjoyed with treating patients with image guidance, I saw a lot of 3D image plans, and they're very profound for the specialty. And so then I wanted to look at how it's been used therapeutically, and I was amazed. Hundreds of publications have been made since the early 90s, and so that made me want to explore VR as a medium of therapeutic use and dive into the research.
Yeah, so what was it specifically? It was that people were not handling MRIs and other locked-in techniques very well, right?
Yes, that is essentially why I worked on my specific project of VR and head-restricted clinical practices, because of radiation oncology and diagnostic imaging is all head-restricted. But what I found, which was interesting, is that the anxiety is present with diagnostics, it's present in radiation oncology, but probably the largest anxiety for people in head-restricted clinical practice is actually dentistry.
Okay, wow, yeah.
That's why we literally, all of my original work and research and development has been with dentistry.
Okay.
Yeah,
I can't tell you the number of times that I've been called as a psychiatry resident that someone's going down to get their brain scanned and they need some Xanax or something like that. So I can imagine if we can come up with some kind of virtual reality assisted program that helps people reduce that fear, that's going to be really
huge.
Good.
Yeah.
We definitely, as psychiatrists, we try to stay away from benzodiazepines as much as possible, you know.
And then that's not enough. I've already had a few patients this year that just because of their anxiety level, benzo wasn't enough. We had to escalate, try to find a nurse that would be willing to give IV sedation. And I'm sitting here nervous, that I'm going to be doing IV sedation when I'm thinking, if only we could modulate this in a different mechanism and not have the risk of IV sedation.
Yeah. Do you feel like Medical College of Wisconsin's been supportive in helping you flesh out this idea and giving you the resources to do that?
Yeah, I think some of it, so it's interesting, I just started at MCW 4 months ago, but before that I was at a small internship program for my PGY1 down in Tennessee. And so there I kind of developed it all myself with some friends in kind of a garage type situation. And then before that, I still have my connections to Mayo Clinic where I went to med school. And so I've somewhat been remotely helping them start research projects, and I've been helping MCW start research projects, and they've been great. They totally are supporting me coming to this conference and and getting the word out and trying to bring this to the field, because there's really only 2 radiation oncologists I can think of, including myself, that are working on VR.
What do you think's been the biggest challenge for getting the idea to fruition for you so far? What is the biggest hurdle to get over right now for you?
Physician apprehension, and also the tech. So at one of the panels today, I really loved it. They asked, what do we need to bring this to mainstream? And I agree with them 100% that simplicity of design and simplicity of tech support, because if there's issues, I was getting called left and right about, it has an update, what do I do? And I'm like, okay, so there's a button, you got to click that button. And then I ended up just doing remote access to all the phones so that they wouldn't have to deal with it. And so I think it's simplicity of design, and then it's collaboration with content providers, which can be its own world of content licensing, but it can be done.
It's a lot to deal with while you're going through residency.
It was a bit challenging, and it definitely, but it's I guess.
Rewarding though, I'm sure, just seeing the project reach different stages of fruition.
Yeah, I kind of let my passions get the best of me, and you make time for the things you love.
Yeah, definitely. So what do you think that you can get out of Stanford Brainstorm, the lab tomorrow? What do you hope to learn?
Yeah, I think my ability to communicate is somewhat very research methodological in structure, and I'd like to be able to present it to a wider audience, and specifically on how to present an idea before you have validated data. We're not at the level of validation, so really we need to get collaborative and creative in how I communicate. And so I think my communication skills, and then also collaboration, because just already, been meeting people and getting ideas for new innovations.
Yeah, I had some lectures today at the third annual Innovations in Psychiatry, Behavioral Health Change Virtual Reality Conference.
That's how exactly. But it's just mind blowing. A lot of the things like Dr. Riva, all of them, him speaking about one, but many of them just awesome concepts.
Yeah. What was the most exciting for you? Do you feel like?
Most exciting for me so far was, I guess, Dr. Riva, with him talking about embodiment and visual embodiment, and having the brain be kind of a pre-coding language that we just don't know yet is exciting. And I guess it's the concept that I came from today saying, I don't understand this, but I think it is exciting.
Yeah. It is going to be really interesting to see how the brain actually handles it once we get it to the resolution in which, it starts having trouble figuring out what's reality and what's not.
Yeah, the rabbit hole goes far.
Yeah, well, I really appreciate you talking with me today, and good luck with the pitch tomorrow. We'll be really excited to see it.
Awesome, thank you.
Cool.
Thank you, yeah. So I wanted to work in head restricted clinical practice, and that really includes a few things. That's diagnostic imaging, radiation oncology, which is actually what I do, and then dentistry is probably by far the largest, one of the largest markets, and also has some of the highest anxiety I've seen as far as at epidemiological level per surveys. It's over 30%. I really was just more lowballing it from population studies that have been done, or surveys. So it's quite anxiety-provoking. In this area of head restriction, as far as the papers that have been done, specifically in dentistry, there's about 20 that I found. Of those, 2/3 use non-immersive VR, which is really using the head-mounted display to project content, traditional content, and I call it void theater. This actually will follow the center of view of the headset. And then another one that was been used is using 360-degree or CGI-based VR, and you use a separate remote control, which is, trackball mouse, these Bluetooth controllers, whatever you can find to use. And then the last one is actually designing programs specifically for head restriction, but I think we're probably another year or two away from that being able to be tested in the clinical setting. And so value proposition, from what I've seen in the literature, is patient satisfaction's increased. And actually, there's an interesting study out in the UK that showed they actually had decreased memory of that experience in comparison to control of not using it. And then also, specifically it's for high anxiety patients. So about half the papers used a dental anxiety scale, which is standardized, and those with high dental anxiety actually had a higher impact, which are the patients they're probably going to lose or not come to the next appointment. And so things that should be measured are patient-reported outcomes. So they should be things like visual faces of pain scales and anxiety scales, customized satisfaction scores, and then I think indirectly referral patterns could probably be looked at maybe 6 months later, and then potentially consumption of the amount of opiates used at that practice, but that hasn't been studied yet in any of the studies that have been done. And so, as far as the target audience, again, ages 6 and up are really the ones that I wouldn't recommend it under the age of 6. Again, high dental anxiety per the studies that have looked at that. Again, this is an outpatient setting for the most part for dentistry, and so and actually usability. I was afraid that these 3-inch machines in someone's head would be a hindrance for dentists, but actually because they're essentially at 0 scale, they they don't have an issue. So this is the first program we made, Avoid Theater. We actually made 2 different versions, one where you can actually see around the video display, one where you don't. That was based off user feedback or patient feedback at the practice that we used it at. The other one is a 360-degree experience. We used a lot of nature scenes, and so usually the patient population seem to enjoy those. As far as scaling, I surveyed 10 dentists, had a range of what they would actually be willing to pay for it. It was anywhere from $1,000 a year to $3,000 a year. And it really depended on how much you're willing to give tech support. They would like everything to be done and have no issues, and that will cost money. And so as far as scaling goes, the dentist, actually, it's interesting, the top 4 dental conferences have over 40,000 participants. So you can almost go to those, and maybe if you get 5% return or 2% return, you're actually doing pretty good. Also corporate dental companies, if you can get contracts with them. AirDroid's what I actually use for remote access. This allows me to do everything with the phones themselves, so if they don't work, I can try to fix them remotely, and that helped with IT. And we initially were trying to build a chatbot, but I think as far as scaling, we go chatbot, remote IT group, and then on-site IT group for those are paying $3,000 a year. Content licensing pipeline would have to be built, and I didn't really get into that, but that is a whole other thing for scaling. The competition out there, there's a lot of people in the VR therapeutic space in a non-restricted setting, and then there's your TV, your iPad. Newcom's just an auditory company that just uses auditory, and then Cubicle Ninjas and Applied VR are some companies I've talked to, and they said maybe by February they might be interested in getting into the space. What's needed for success? The content pipeline is a huge issue, just being able to get content that's quality, and then really the only competitive advantage I think is network effect in this space.
So first of all, Brandon, thank you. This is a really interesting idea. And 2 questions I want to ask. One is just about how you came up.
I was smashing this, yeah.
The business model and kind of the pricing. While I think it's interesting to ask people how much they would be willing to pay, and that's a whole element of how, what people would do. I think that what would be actually more interesting is getting a sense of the return on investment. So for you to be able to actually quantify, what is the, how many patients are actually coming back as a result of your product, and be able to show them, if you use my product, that this will save you $50,000 a year, and then pay 10% of that for my product versus arbitrarily how much would you pay for this. Most people are not as good at actually figuring that out. So I think that in order to really figure out your business model, it's important to kind of be able to have more concrete elements of the value that you're offering patients as well as the dentists who really are your customers, since they're the ones paying. That's number one. That's just a little feedback. The second thing is you mentioned opiates, and obviously, we're in the middle of this opiate crisis in our country. And I'd love to hear your thoughts on how you think that this can be a part of that solution.
Yeah.
In like 30 seconds.
Yeah, so conscious sedation is becoming quite common in education for dentists, and so they use, or it's actually more benzos, but they do use more opiates for high anxiety patients, and so I think that this will probably garner maybe 5 to 10% of that population that has moderate levels of anxiety that you could attenuate with VR instead of a conscious sedation product. So it'll go into that market, and I guess yeah.
From a marketing perspective, I think that's very interesting because of how much this issue is in our society right now, and also for funding, both from like government funding as well as philanthropy.
So Brandon, wonderful idea pitch. You mentioned something about you could, from your own Android, oversee what's going. How many people is it going to take to maintain, and what type of leadership personnel structure?
Probably if you just at like one state level and you have maybe, we had 3 practices. I think if you had like 40, somewhere in the lower teens, then you could probably manage it with just 3 people using just an Android interface with these remote access ports to their phones. But after that, you do need probably a whole team of tech support, and the on-sites where it gets really tricky. That's the logistic issues of coordinating with on-site local tech support. That I haven't thought about that far as scaling.
Okay.
Brandon, thank you for a really great presentation. Actually, I had 2 questions. Can you kind of tell us a little bit more about what the competitive landscape for this kind of application looks like? And also, you kind of alluded to kind of some of the difficulty with kind of being adopted by some of the clinicians. Can you kind of also tell us a little bit more about kind of what are some of your maybe top 2 kind of key challenges?
Yeah. So competitive landscape is really almost none in dentistry. As far as VR companies, there's other companies like Newcom is essentially the only one that's working with this anxiety component and using auditory headset. I read their literature on research, and I didn't see anything that had been published in PubMed, so I was a bit concerned. But they TVs, iPads, traditional things. I think always that's there. And then, but yeah, no one in VR yet, but maybe in a couple months. So not much for the competitive landscape. And then your question of what are the 2 top issues, these are all trials I'm not going to go over, but the other one is cart before the horse. I think evidence, so if you wanted to get Kaiser or a big Aspen Clinical, they're going to want evidence, and so, let's see. So I think insurance companies and whatnot are going to pay, you're going to need like phase 3 or high randomized control trials, and the thing I've seen the best was maybe 120 patients being randomized, and I think that's pretty good. It was a pretty good study, but I only saw 2 of those out of 20, and so I think we need more data. And then also just adoption, so like what is this? Is it for video games? Bridging that gap of stereotype, and then research, which will probably be solved combined with a large trial.
Thank you, Brandon. I think, how much time do we have left?
30 seconds.
Oh, 30 seconds. Any audience questions? Last 30 seconds? Go ahead.
Question. 2 interrelated questions. What protectable IPR is coming out of this? And related to that is, what's your market differentiator? What's to stop any established VR entertainment company just doing 360 videos, putting in the headset and eating your lunch?
Yeah, absolutely. So there's absolutely none. There's absolutely none for IT protection in the area of tech companies, I believe. I don't think that's a real competitive advantage because you can't get a patent. And so really, it's just a network effect. So if you get Kaiser Permanente, or if you get a large enough network, so why does Facebook succeed? Why does Y Combinator buy into the network effect? They do it because once you have...
Are you looking for early mover advantage?
Right, that would be the only thing you would have, but it's very hard because I'm from Tennessee and I all of a sudden worked on this, so the barrier of entry must be small.
Thank you.
Yeah.
Thanks, everybody. Thank you so much, Brandon.
Thank you.